So today we have with us Dr. Pamela Mirsky. She is the assistant professor at the University of Arizona College of Medicine, Department of Psychiatry. She's board certified in psychiatry, consultation liaison psychiatry, and integrative medicine. Her current role includes working in integrated outpatient settings, such as the primary care and inflammatory bowel disease clinics, and her passion for mindfulness and meditation led her to establish the Mindfulness Clinic at Banner University Medical Center South, where she sees individual patients for mindfulness-based psychotherapy and teaches mindfulness-based cognitive therapy groups for depression. It's a mouthful, but thank you so much, Dr. Mirsky, for joining us today, and I'm going to let you take it away.
Okay, thank you so much. Let me just share my presentation.
Real quick, while she's getting set up, just a reminder that we will take questions and answers through chat today. So if you can use the chat to give us any questions and answers, and after or questions, we'll give you the answers. And after the presentation, we'll bring you on and help moderate questions so you can ask them directly. So again, thank you so much for joining us, and take it away, Dr. Mirsky.
All right. Well, thank you again. And I'm really excited to be here talking about my favorite topic, which is mindfulness. So let's first just take a moment to arrive here. Maybe you're rushing from another meeting, or maybe you just had lunch, whatever it is. Now we're here. So just taking a second, maybe taking some deeper breaths. You can close your eyes if that feels good. And then just releasing any obvious tension, softening the face, unclenching the jaw, dropping the shoulders, and just softening your belly, relaxing into your seat, maybe feeling your body in contact with your seat, or maybe you're standing or lying down, feeling your feet on the floor, the position of your hands. And then just seeing how you feel now after taking that brief pause. And this is just the start of, being mindful, being present. Here's a definition of mindfulness. So mindfulness is the awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to things as they are. And Jack Kornfield really suggests that we start, instead of calling it mindfulness, we really start calling it mindful loving awareness, to make sure that we're not leaving out this compassion and kindness aspect of the practice. And so you can see that this isn't just bare attention. While mindfulness is about directing and sustaining our attention to the present moment experience, it's not only about the fact that we're paying attention, but how we pay attention. So you might be looking at this non-judgmental part of things and thinking, oh, that sounds impossible. But what this really means is that we're becoming more aware of how judgmental we are, and then seeing if we can let go of that judgment, even just for a few moments. Here's another way of looking at mindfulness from Nyanaponika Thera, who was a Theravada monk. So mindfulness is the unfailing master key for knowing the mind, and is thus the starting point, the perfect tool for shaping the mind, and is thus the focal point, the lofty manifestation of the achieved freedom of the mind, and is thus the culminating point. And Jon Kabat-Zinn said about this quote that, seen in this way, mindfulness is the view, the path, and the fruit all in one. So you can really see how powerful this process can be, right? With mindfulness, we can start to get to know our mind. And then once we know our mind, we can then start shaping it. And this leads to more freedom. So I didn't discover, mindfulness formally until a little bit later. But when I was in my 20s, I was having a really rough time. I remember sitting at my desk. I was experiencing a lot of feelings of overwhelm, of heartbreak, and I could feel this, tightness in my chest, in my throat. And I came across this quote by Hermann Hesse, and it's, "You know quite well, deep within you, that there's only a single magic, a single power, a single salvation, and that is called loving. Well then, love your suffering. Do not resist it. Do not flee from it. It is your aversion that hurts, nothing else." And when I heard this, all of a sudden, I could feel this opening, this shift, this space. I could breathe again. So this is really a huge, important part of what mindfulness is. Can we just learn to be with our experiences and not try to make them different than what they are, to push away, to fight against our feelings or tell ourselves we shouldn't be feeling what we're feeling? So it's this radical idea of embracing our suffering. And that actually, when we do push against, or we have this aversion to our suffering, it actually perpetuates our distress. So you can kind of try this for yourself. This is a technique called RAIN. It's been around for a while, but this is Tara Brach's version of it. And this is a way of just bringing this pausing, this awareness into your current experience. So it's a 4-step process with this acronym. So the first step is R, this recognize. So right now, you can tune in for yourself. You can close your eyes if that feels right or not. And just seeing what's here, what thoughts, what feelings, what body sensations are present right now. And then the second step, the A, is allow. Can you allow the experience to be just as it is? Then the third step is investigate. So can you bring a more focused attention to this experience? What's happening? Where are you feeling this in your body? What is it that wants attention? What wants acceptance? And this is primarily, somatic, not cognitive. And then the fourth step is nurture. So can you sense, is there a hurting place? Is there something that you need? Can you offer care to yourself? You can think for yourself, what would be most healing? What would be a source of compassion? And sometimes a great source of compassion can just be putting a hand on your heart, or you can bring in someone in your life who you feel is a source of compassion for you, or just maybe a source of light that feels healing, thinking of a space that is healing for you. It can be any number of things. And so this whole process, it's just the start of pausing, of being with what's happening and not fighting what's already here. So it might feel like this, right? We don't have to keep running and running. We could if we want to, but let's have it be a choice. And you might be thinking, well, like, why do I want to pause? Why do I be more present? What does it matter? And also, what does this have to do with mental health? So the reason that this is so important, and the reason that this relates to mental health, is because most of the time we're on automatic pilot. And what that means is, like, you've probably noticed maybe when you're driving and you don't know where the last 5 minutes have gone, right? And during these periods of automatic pilot, our mind tends to wander. And this is okay. It's the nature of the minds to wander in this way. But the problem is that it can be particularly dangerous when our mood is sinking, and then our associations and memories are likely to be more depressing or anxiety provoking. And so therefore, it's really good to know what's going on in this stream of associations, and then to be able to disengage intentionally. So if you're more aware of thoughts, of feelings, of sensations in the body, then you can actually change your experience. You have more choices, more freedom. And so mindful awareness offers this different way of relating to things in contrast to automatic pilot. So just to reinforce, we're not aware of what's going on a lot of the time. So if we can bring awareness, then we can become aware of aspects in life that might otherwise just slide by us, right? Both the good and the bad. And you might be thinking, why would I possibly want to be more aware of bad things? They're terrible. But so if we're not aware of the good, that means that maybe life isn't as rich as it might be. And if we're not aware of the bad, then that means we're not in a position to actually take skillful action for ourselves. And that's when depression, anxiety, or other bad habits can creep up on us when our minds are elsewhere. So we can't actually change, what comes into the mind, but we can control what we do next. And you might be familiar with Viktor Frankl, who he's a famous psychiatrist, a survivor of Auschwitz. He wrote a beautiful book called Man's Search for Meaning. And there's a famous quote from him that says, "Between stimulus and a response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. the last of human freedoms is to choose one's attitude in any given set of circumstances. So, sorry, I love this cartoon. It's just the donut looks so sad, you know? But so when we think of mindfulness, you got a little taste of, you know, what happens with that rain practice, but generally we break it into informal and formal practice. So informal practice would be, you know, it involves introducing a mindful attitude into daily activities like eating or brushing your teeth or interacting with others. Like, you know, I had a woman recently tell me that she noticed when she was brushing her teeth, she was always holding her phone in one hand and just scrolling through and just totally not paying attention to the actual brushing of her teeth. So if you bring some more curiosity into this experience, you might discover that maybe you're not even brushing a whole side of your mouth. Since that's what this is about, this informal practice, just really starting to tune into these experiences that maybe we're used to having our minds be elsewhere. And then there's formal mindfulness practice. So all of these methods involve having a focus of attention, and then that we're trying to keep our focus on. And then when our mind wanders, we, as best as we can, try to notice that and then gently bring our attention back to the given focus, just kind of over and over again. The mind will wander over and over again. And so with sitting meditation, the focus might be the breath, feeling the sensations of breathing, or it could be sounds. There are other things that can be the focus. In the body scan, we go through each part of the body, systematically bringing our attention to each part, really feeling into each body part. Mindful walking, generally you start by choosing like a 7 to 10 pace area, and then you just kind of slow down that movement of walking and really tune into the physical sensations of walking, feeling your feet moving, the muscles, everything that goes into it. And then there's mindful stretching or movement, and we can do a simple stretch right now. You know, and please just do what's comfortable for you. Don't extend your body in any way that doesn't feel right, and just know your own limits. But if you're sitting, you can just reach out your arms, right? And then you can kind of tune into what that feels like, the stretching of the muscles. And then on an in-breath, you can just reach the arms up, stretch up if it feels good. And this feeling that stretch in the arms, you can move your hands around, maybe feel a stretch in your side. And then on an out breath, just coming back down. And then with your arms still again, just noticing what you feel there. I can feel some tingling, my shoulders feel a little more open just from that one simple stretch and tuning into it. So a woman comes to a mindfulness class and she says, I'm meditating on my inability to meditate due to the fact that when I meditate, I can't stop thinking about how I can't meditate because I'm thinking about my inability to meditate. Is that correct? So, you know, it might feel like this when you start to do more formal practice, like your mind is all over the place and you're just thinking. But just again, remembering that mind wandering is totally normal, and we're not trying to stop our thoughts. This is a really common misconception about meditation. As we practice more, we might find that our thoughts quiet and things quiet down a little bit, but we're just trying to get to know our mind first, trying to notice when it's wandering, notice where it's going. And you might be wondering, well, how often do I have to do this? You know, how much? So, you know, just like with physical exercise, you know, you wouldn't expect to run a marathon right after you start. So just watching your expectations, give yourself time. You don't have to, you know, do a full retreat when you first start, or you might not be capable of something like that. And so there is evidence that there's a lot of evidence now that actually the frequency is more important than the duration. So being more mindful on a regular basis, like we said, doing those informal practices or just doing like 5 minutes of sitting meditation, you know, and again, similar to physical exercise, it's better to do a little than nothing at all, right? So it's better to climb a flight of stairs than to take an elevator. It's the same sort of thing. But there are these studies that say like just 10 minutes of mindfulness overcame the damage to concentration from multitasking, and this was in the short term. 10 hours of mindfulness over a 2-week period strengthened attention and working memory and led to improved scores on the graduate school entrance exam, the GRE. So this is really cool, and it's really great that we can see these changes really rapidly. But more lasting benefits do require ongoing practice. Similar to like if you ran a marathon 10 years ago, but you haven't kept up running, you're not going to expect to run a marathon tomorrow. So, he says, I feel sorry for people who can't enjoy this moment like me. So just remembering that this is about really feeling into your experience, remembering to have humility, and remembering that this is really about developing compassion for ourselves, compassion for other people. So where does this practice come from? So it originated in the Vipassana components of Theravada Buddhism from Southeast Asia, and Mahayana Buddhism, for example, Zen, from East Asia, and been around for over 2,500 years. So this isn't new. And these meditative practices cultivate clarity, emotional balance or equanimity, and compassion, and confront and reduce suffering. And this is what it's all about. This is what we're doing. We can really thank Jon Kabat-Zinn for bringing these practices into medicine. So he developed MBSR, mindfulness-based stress reduction. And in 1979, he started the stress reduction clinic at the University, of Massachusetts Medical Center. And he said this was, originally designed as a referral service for physicians and other health providers, where they could send their patients with a wide range of diagnoses, conditions, who weren't responding to more traditional treatments, were kind of falling through the cracks of the healthcare system. And he wanted to offer this environment where people could experience with facing, exploring, and relieving suffering through this mind-body connection. And he said, as you can see in the first quote here, this was MBSR was really conceived as a public health intervention, a vehicle for both individual and societal transformation. And he was really passionate, still is very passionate, about that mindfulness can only really be understood from the inside out, right? So it's not just another technique, it's really a way of being and a way of seeing that has profound implications for understanding the nature of our own minds and bodies, and for living life as if it really mattered. And he said, we make every effort to treat each participant as a whole human being rather than as a patient or a diagnosis or someone having a problem that needs fixing. And then, that's people start seeing themselves in that way as well. And this is what makes, mindfulness so powerful, so important. Mindfulness helps us learn to rely on our own inner resources. It gives back control, enhances self-efficacy, and it teaches us better ways to meet the challenges of everyday life. My teacher, Tanisra, said it's cultivating our ability to tolerate reality. And so, this isn't a quick fix. This is really a participatory medicine. It's a tool to teach you to help yourself. So again, what is the process? What does this kind of look like when we're practicing? So it involves repeatedly observing the mind moment to moment. The content of like a particular thought or a memory or idea is really less important than how we're holding on to these things. And repeatedly being with and accepting this moment-to-moment experience will lead to insight into the workings of our minds, which then brings more relief from suffering. And this also allows us to embrace the full range of human experience. So it might feel really intellectual at first. It's, and doing a lot of reading about mindfulness, listening to this talk, it's all great. It's all really important. But this is something that can really only be understood by practicing, something you really have to experience for yourself. And I wanted to touch in on this kind of how we look at the self when in this kind of mindfulness paradigm. And this is from Jack Kornfield's book, The Wise Heart. So, he talks about how kind of in our traditional Western psychology, the ego kind of describes this healthy organizing aspect of our mind, and it's used to develop a healthy sense of self. But in mindfulness-based interventions, the ego is used to describe qualities of self-importance and self-centeredness that arise from this small sense of self. And the goal is really to move away from the ego to a sense of non-self, and where we discover that our sense of self is tentative, false. And if we can release from this identification with the self, then we can find improved mental health, freedom, compassion, and joy. And when you first hear this idea of non-self, feelings of confusion or fear can come up, or you might be thinking, I like myself, I don't really want to get rid of myself. But this isn't about, changing anything or getting rid of anything. I mean, you might find that you want to change something, but this is really about learning to see through these false ideas of ourselves. And then we discover that we can let go of this limited sense of self, and that this grasping and identification are optional. And so this might sound really like esoteric and what am I talking about? But you can just think, for example, maybe you get, maybe you get really happy, when you receive praise, or you're awarded with titles or accolades or something. And these things are great, right? People need to be appreciated and rewarded for things that they do. But then maybe when someone says something negative or criticizes you, you feel depressed and devalued. So instead, can we not get too happy or too depressed based on what others say? And can we just learn to trust in our own, our own innate knowing, our own heart? So this really offers a path to the discovery of selflessness, and showing us that the self is really created moment to moment, and that there's this joyful openness that exists beyond the self. So she says, "Hi, I'm Marcy Peterson," even though there's no such thing as the self. So mindfulness has become very widespread, as I'm sure you're aware. So that's also brought a huge increase in how much it's studied. And there's the American Mindfulness Research Association keeps track of all of the mindfulness journal articles from 1980 to the present. You can see in 1980, there were 0. In 2000, there were 10. And in 2019, there were 1,203. So it's pretty crazy. And it's really great because then, now the more it's studied, the more we can know what mindfulness helps with, what it doesn't help with. And as evidence accumulates for the efficacy of mindfulness-based interventions, some countries have even included these interventions in their clinical guidelines. So for example, within the National Health Service in the UK, MBCT, or mindfulness-based cognitive therapy, which I'm going to talk about in a few moments, has been recommended by the National Institute for Health and Clinical Excellence as a treatment of choice for people with relapsing depression. And so mindfulness-based interventions have been shown effective for depression, anxiety, substance use disorders, pain, amongst other things. So I wanted to talk for a minute about depression. So I mentioned mindfulness-based cognitive therapy. This is a group. I teach MBCT, and it's designed for individuals with a history of depression. It combines MBSR, mindfulness-based stress reduction, which we mentioned earlier from John Kabat-Zinn, and the concepts of cognitive behavioral therapy, and helps prevent relapse from recurrent episodes of depression. So again, using these skills, it helps people find a new way of relating to thoughts and feelings and body sensations, as we've been talking about. It's 8 weeks, consists of about 2 hours a week, and then there's about an hour of home practice. So each day, so it's a lot of hard work, but it's really, really rewarding. And here's some of the evidence. So what we've seen is that MBCT significantly reduced the risk of relapse from depression relative to usual care. by 35%. And this was even more in people who had 3 or more past episodes of depression. And then also saw that MBCT and antidepressants reduced relapse to a similar degree. Another big study showed that MBCT helps prevent depression recurrence as effectively as maintenance antidepressant medication. So this is really great, right? Because, you know, some people don't want to take antidepressants forever, or they want something in addition to antidepressants that, you know, makes them feel like they have more control over what their experiences are. So, you know, I can talk about the research a lot, but I think what is really telling is the comments from people who have been through the group. And I don't share these to reflect on me. This is really about how powerful the practice is. So at the end of the group, I ask people to rate the group on a scale from 1 to 10. How important has this program been to you? And then ask them to please tell me why. And they spend a lot of time sitting and writing about why. So let me share a couple of comments. So the first person says, this program has given me the tools and resources to better navigate through not only difficult times, but daily life in general. Excuse me. To better protect, nurture, and strengthen my well-being, and thus the well-being of those around me, to remember and proactively enjoy this life. Second person says, this program session course has been a lifesaver for me. It has helped me to get in touch with past hurts and emotional scars that have kept me in a deep sadness and guilty way of life. I was finally able to work through these things and learn how to deal, cope, accept the emotions that I feel on a daily basis. I stopped labeling everything I feel and just allowed myself to simply feel. For the first time in a very long time, I'm hopeful and willing to make the necessary changes in my life to keep myself healthy and living. And the third person says, I came to this mindfulness-based class expecting to find a way to control my anxiety and depression. In this program, I learned to accept my emotions, feelings, pains, and everything that is in my body and mind. I learned a lot about myself, and I learned to love myself as I am. It was a great surprise for me to understand that accepting our feelings, pains, events that occur in our mind, with accepting them and providing time to feel them, that is the way they won't bother us anymore. So I just find these comments so moving because this is really just touching every aspect of life. This is liberating people from their old scripts or narrative about, you know, who they were, what they're capable of, what their life is supposed to be. And now they're just really working with the authenticity of themselves, and seeing their wholeness and feeling more connected both to themselves and to others. And so, of course, I love mindfulness, but just like any intervention, it's not without adverse effects. So with the rise in popularity of mindfulness and the proliferation of its uses, it's been accompanied by these ideas, right, that mindfulness is a panacea, that it's harmless, that anyone can teach it. So as mindfulness becomes increasingly hyped and commercialized, you know, in our society, it's just really important to understand its limitations and seek out teachers that are properly trained and devoted to their own mindfulness practice. So challenging meditation-related experiences can include changes in perception, in affect, in our sense of our bodies, our sense of ourselves, cognition. And many of these experiences are part of this normal process of deepening meditation practice and can be handled with this non-judgmental awareness that we talked about earlier, that's applied to any and all of our experiences in the course of meditation practice. But in some individuals, these experiences may turn serious, and there's been reports of adverse effects, including psychosis, depersonalization, mania, or other destabilizing events. So just given this potential for adverse events, it's just important to have a knowledgeable teacher who can differentiate between, you know, what's a normal experience and what's not a normal experience, and seek out appropriate support. Another thing to be aware of is that re-experiencing traumatic memories is really common in meditation, so and can become a significant challenge. So if there's a significant trauma history, it's important to have appropriate support. And that, just again, making sure you have a teacher who is trauma informed, trauma sensitive. And a lot of these, the more established mindfulness-based interventions like MBSR, like MBCT, have training pathways in place. So, and these include requirements for personal mindfulness practice, mentorship, supervision, method, and they assess teacher competence. So, just do your research when you're finding a teacher. Okay, and so how is this all working? How are these changes coming about? So the brain is really the only organ in our body that's designed or built to change in response to our experience and our training. And we call this neuroplasticity. And so the meditative practices through this repetition can induce neuroplastic changes in our brain. So, like physical exercise builds muscles, mental exercise or habits build brain networks. You can think of this as mental fitness, brain training. And you may just want to consider for yourself, it's like we're always practicing something. So are there things you might want to choose to cultivate, or are things you'd like to weaken or abandon? Here are some mechanisms that have been identified: improved attentional focus, improved cognitive flexibility, reduced affective reactivity, modification or shifts away from distorted or exaggerated self-view. All right, so let's get more into the brain itself. So in the front of our brain, sort of right here behind our forehead, we have our prefrontal cortex, or the PFC, and it's involved in a wide range of complex functions that include thinking and planning and control of behavior. It controls something that we call executive functioning, which includes self-control, self-regulation, especially around attention and action. So what we've seen is that meditation strengthens the PFC, and that this therefore leads to increased emotional control and increased well-being. And then the PFC is responsible for modulating other brain areas that include the limbic system, the default mode network, and the brain reward system. We're going to talk about a few of these on the next slide. So, if the PFC is underactive, then the system that it's supposed to regulate is going to be disinhibited or out of control. And it's going to lead to a bunch of different problems that can include depression, bipolar disorder, obsessive compulsive disorder, and addiction. Okay, so I mentioned the limbic system. The limbic system is a set of interconnected brain areas that are involved in memory, emotion, motivation, reward. One of those is the amygdala, which helps us detect threat and is involved in our, fight, flight, freeze response coupled with our endocrine and sympathetic nervous system. And those reactions that we experience, the bodily expression of that experience and the emotional reactions. So like a pounding heart, a feeling of being frozen with fear, a sinking feeling. And so the PFC is going to exert control over the limbic structure, such as the amygdala. So if there isn't this control, then the amygdala is going to be hyperactive, and then we're going to have more emotional reactivity, more hyperarousal, such as we see with anxiety, depression, and other kinds of disorders that have a lot of negative emotions. And then there's a structure called the default mode network that the PFC also modulates. So, and this is a really interesting structure. So it's active during rest or when our brain isn't otherwise engaged, and it's thought to be involved in self-referential thought and mind wandering, which is obviously very important to what we're talking about. The default mode network is responsible for our self-narrative, this kind of story of me, and other forms of social cognition, like imagining what other people are thinking or feeling. So some degree of self-narrative and social cognition is helpful so that we can function in society. But a lot of the times these stories that we tell ourselves or imagine that other people are telling about us are going to be excessively critical or negative or just excessive in general. So if a default mode network is overactive because the PFC isn't sufficiently regulating it, then we're going to have more distress, more anxiety, more rumination, more depression. So again, what we see is that meditation decreases limbic and default mode activity, and that this leads to improved attention, less emotional reactivity, less rumination, and that this therefore helps with our addiction and mood disorders. So you might, feel like you have a circus monkey in your brain, and that's totally fine and normal. And, we've talked a lot about this change and potential for change, but I just really want to make sure that we get back to the beginning and remember that mindfulness is first really about accepting where we are right now and being with our experience as it is. There might be an opportunity for change, but first we really have to get to know our minds and starting to trust that we're really mostly okay as we are. And we can start to embody this wholeness and really learn to trust in ourselves. And again, this is really hard, right? We naturally don't want to be with things that are bad or negative. So this is a learning process of being with what's here. I wanted to share a story of a woman who came to see me to help kind of show how these things can kind of play out. So I'll call her Beth. She was a woman in her mid-60s. She had a history of anxiety, of depression, arthritis, hypothyroidism, and she came to see me looking to reestablish with a psychiatrist after about 8 years. She was being seen by her primary care provider, who was prescribing some psychiatric medications, but she had been experiencing some worsening depression, anxiety, and was hoping that mindfulness-based treatment could help. So she'd done MBSR in the past and had found it to be really helpful, but she hadn't kept up a regular mindfulness practice. So she told me that she was feeling particularly overwhelmed with the pandemic and the political climate of the country. I'm sure many of us can relate to that. And then she'd also had a recent surgery, and it was the anniversary of the loss of her beloved dog. So she described to me these episodes of increased anxiety that then turned into sadness and resignation. And as we discussed her anxiety further, it became really evident that Beth was often trying to push her anxiety away. And this was accompanied by thoughts that she shouldn't be feeling anxious. So we brought this more accepting and kind approach to her feelings and thoughts. And again, with this explanation, going back to that Hermann Hesse quote that, when we push things away and don't allow ourselves to feel what we're feeling, we often create more suffering for ourselves. And then she also started to do some formal practice, including sitting meditation and the body scan in between our sessions. So after a couple of visits, Beth said she was still feeling anxious, but she excitedly relayed this story of taking a walk with her dog. And in that walk, she experienced a surge of anxiety. But instead of going into her usual what ifs, as she called them, and rumination, she decided to simply acknowledge the feeling of anxiety and breathe with it, allowing it to be present. She then noticed that the feeling gradually dissipated, which was a very welcome change from the normal spiral of negativity that she was used to experiencing. And then at our fourth visit, she reported she was doing really well. She described this feeling of being better able to notice anxiety, sadness, and frustration when they arose, and then better able to stay with those feelings when they were present. She felt able to create, sorry, my light just went off. She felt able to create space for these feelings and to just let them be instead of diving into them or fighting against them. In addition, her energy and her motivation improved. And when she started to tune into more of her thoughts, she noticed that she had this tendency to berate herself for not being perfect and thinking that she was failing or calling herself a loser. And these thoughts were kind of there frequently in the background. So again, we brought some more compassion towards herself, and just holding these thoughts as she did with the other feelings. And then at the 5th visit, Beth reported that she was feeling really stable and had the tools necessary to be on her own without these frequent visits. And so I think this is just a really nice example of how, the incorporation of formal and informal mindfulness practice and kind of exploring through these things can really lead to some resolution of the suffering. And this was a really quick resolution for her, and sometimes it takes longer. So everyone's just kind of on their own path. I wanted to take a moment to talk about meditation apps because people always have questions about them. And it's just kind of a brief word of caution. So, a study in 2015 identified over 600 apps and that claimed to be mindfulness based, but really showed that only 23 actually provided mindfulness training. And there's just, overall, there's just a limited amount of evidence on whether these apps improve mental health, especially in clinical populations. So, there is a small amount of evidence so far that's mostly focused on stress reduction and improving well-being, and those seem positive. And so if that's what you're looking for, then that's great. But just kind of going back to that limitation and caution slide, we just need to be careful if we are experiencing more significant mental health issues, then apps might not be the way to go. And then there's just also some evidence that standalone mindfulness practices like the body scan or a breathing meditation aren't going to be as effective as when it's integrated into a larger therapeutic context like we have with mindfulness-based stress reduction or mindfulness-based cognitive therapy. Okay, and then here are some resources. So you might want to, take a screenshot of this page. It's just, there's a lot of a bunch of websites. They kind of range from general to there's some academic ones, and then more Buddhist ones. You can kind of decide for you what's appropriate. I do list some apps here. I'm not a spokesperson for any apps or anything, but these are some of the more thorough ones. I personally do like to use Insight Timer. First of all, it's free. It's also just really nice. You can just use it as a timer if that's all you're interested in, but it also will just show you all the people in the world that are meditating with you at a given time. So it creates a little bit of a sense of community. And then it also does have a lot of offerings from well-respected teachers in terms of guided meditations. And then I've also put on here the Cheetah House for meditation-related difficulties. They have a ton of really great resources on their site. And so then I will just leave you with this Zen Buddhist saying, if you understand, things are just as they are. And if you don't understand, things are still just as they are. So thank you so much. And I am happy to answer any questions that people have.
Thank you so much, Dr. Mirsky. And I actually took your resources and posted them with the links into the chat for everybody as well, so they can have that. And also just to remind everybody that this will be available as a recording on our mental health website link that we've put in your chat as well. So we've got a couple questions that have come up, but just remind people that if you'd like to ask a question, please put it into the chat and we'll help moderate and bring you on. So our first question comes from, one second, sorry for the delay. Joan Grabenstetter, if you would like to unmute yourself and ask your question. Joan, are you able to unmute yourself?
Okay.
There you go. There you go. You're set.
I was just asking about the use in people who are bipolar. I can see bipolar 2, but bipolar 1, can people actually use this?
Yeah, so the evidence isn't as strong with bipolar 1, but and then just do have to be careful, just monitoring, for any switches to mania, that sort of thing. But in terms of the depression aspect, it can definitely be helpful.
Thank you.
Sure.
Steve Sumter, you can unmute yourself and ask your question if you'd like.
Hi, thank you very much for this. It's very useful. One of the techniques that I find useful with clients I'm working with is use of positive affirmations, where I have them write a new behavior or thought they would like to memorize. I'm wondering if positive affirmations can be used while they, let's say if we combined some kind of a practice of mindfulness and have them repeat or focus in on a positive affirmation, would that be useful?
Yeah, I mean, definitely. It's a little separate from mindfulness, but
Right.
I mean, definitely helpful. I mean, some forms of mindfulness use mantras, and so, but the point is that it's really just about that, bringing your attention back to a single thing. So they could definitely work well together for sure.
I just wondered if that would be a good supplement, or if it would draw attention away from other things they're supposed to be doing.
Yeah, I mean, the mindfulness practice might be separate from the positive affirmations, but there are, I mean, you could think of, in a way, loving kindness is kind of positive affirmations. You're saying to yourself, may I be safe, may I be well. So I think, it just kind of depends on the context.
Yeah, I work with a lot with stress and anger management in my practice. So I just most of the positive affirmations are geared to reintroducing another way to think about when they're angry that's more adaptive rather than what they do think.
Right.
Thank you.
Yeah, thanks.
Next question, I may not get this name right, but Maxime Pinot Valencine. I'm going to take a stab at that. If you'd like to unmute yourself. I'm not sure if it does not appear to be working. But so I'm going to ask the question for Maxime. It says you cited very good reason to find a well-qualified teacher for MBCT. Can you indicate important tips for this? Should they be a psychiatrist?
No, it doesn't need to be a psychiatrist. Generally for MBCT, though, you do have to have some sort of mental health training background in order to go through the teacher training. And that includes knowledge of cognitive behavioral therapy. So I would just kind of make sure that they're maybe they've started some of the teacher training pathway process. There's also a website called Access MBCT, which has people that are registered MBCT teachers or like qualified teachers. Yeah, so hopefully that helps.
And our next question is Carlos Garrido. Carlos, if you'd like to unmute yourself and ask your question. Carlos, are you able to unmute yourself? Well, I'll go ahead and ask his question too. So what would you recommend for someone who has been dealing with adult ADD and finds holding attention introspectively a challenge?
Yeah, definitely. I think it's all about just doing what you can. You can start really small. So, you don't have to do like a 30-minute sitting meditation. You can just start, you could start with more of those informal mindfulness practices. Just really starting to bring your attention, say when you're, washing the dishes or something, just really tuning into that experience. And then just noticing every time your mind wanders, you just try to notice as best as you can and come back. And it might be very challenging. I mean, it's challenging even if you don't have an attention deficit disorder. So you can just start, really small and meet yourself where you are.
Our next question, and Carlos did mention that he couldn't unmute, so I apologize. I saw that late there, Carlos. Joy Subrin, if you'd like to unmute yourself, you can ask your question.
Oh, I think I got myself to unmute.
You
Can you hear me?
Yep, you're
Yes.
good. Thank you.
All right, accomplishment of the day. I just have kind of a big ask, but I really appreciate mindfulness. And I wondered if there were any researchers or articles that come to mind that I could look up to show to others. I work with pregnant and postpartum women just to show the effectiveness. I don't know if there was a researcher on the top of your mind. I can do the research, but if there was somebody that you favor or you've seen an interesting article about maternal mental health mindfulness.
Well, as you saw, there are about 1,200 that were published in 2019 alone. So there's, it really depends, what'd you say? Sorry.
There's plenty. Sorry, I'll go.
Yeah, I mean, so it really depends what you're looking for. There's tons of and also, I mean, if you're aimed at that specific population, I'm not, nothing comes to the top of my mind in terms of pregnant postpartum women, but yeah, so I don't have like a good quick answer for you for that.
That's okay. I think I'll just look up the 2009, 2000 studies, but I think it's a great tool and it's accessible, and thank you for everything you shared.
Yeah, thank you. You're welcome.
Our next question is from Jeanette Hall. Jeanette, if you'd like to unmute yourself and ask your question.
Thank you for doing the Zoom class. A question on insomnia and anxiety at night mostly. Does the mindfulness practice, the techniques, the MBCT potentially help with that?
Yeah, so kind of in the way that, as we reduce our anxiety and reduce depression, then that therefore helps with sleep. There are some studies also just on sleep alone, but those are kind of, we don't have as much research on that, but it can, the technique can be used to help, calm the mind, quiet the mind a little bit at night.
Thank you.
All right, and it looks like we've got Phil Morgan. Phil, give me 1 second here. Go ahead, Phil, ask your question.
Oh, okay. Yeah, I just was wondering if you were aware of the local meditation centers around Tucson, and if you had any thoughts or opinions on their efficacy for teaching mindfulness.
Yeah, good question. I am definitely familiar with them, and I don't want to endorse anyone in particular, but I mean, I know that a lot of them do have very well-known teachers who have been trained through some of the pathways, like through the Spirit Rock teacher training pathway, and you can usually see those things. They'll have information on the teachers in their bios on the website.
Thank you.
All right. Well, we've had a couple other kind of add-on comments about that the Pima County Library has some great resources available for people to check out. And I've got a question for you. It kind of relates to our last session we had on sort of the state of mental health in Arizona. But so with your program, how are things like insurance coverage coming along with to help with people with these sort of programs like you offer?
Yeah, so I mean, for the group and And for individual treatment, it's just similar to any other group or individual, appointment with a psychiatrist. So it just depends on the insurance coverage. Usually there's just a copay for each session of the group. And we've been doing things virtually for a long time now. So and luckily the insurance companies have continued to pay for those things. We don't know what's going to happen in the future, but hopefully they'll continue.
Great. And actually somebody just asked, do you accept ACC HHS? Are you familiar with it?
Yeah, so access. So yes, because generally at the our South Campus clinic, we aren't always able to take access patients because those patients go to our whole health clinic. But because this group is not offered at the whole health clinic, we are able to take access patients. Or I'm able to take access patients for the group.
Wonderful, wonderful. Well, if anybody else has other questions, please pose them. But I think we've kind of come to the end of the question and answer otherwise. But really want to thank you for your time today, and thank the College of Medicine Department of Psychiatry for helping with this series this spring. And this will again be available as a recording on our mental health series website right off of our homepage, and we've posted that link in the chat. And Dr. Mirsky, is there anything else you would like to add today?
No, I don't think so. Yeah, thanks so much. This was really fun.
Well, thank you all, and thanks for everybody joining us from around the country and in Tucson, and our members of Osher Lifelong Learning Institute. And we hope you all are well and safe, and we look forward to seeing you next time. So thanks so much again. Take care.